Our research study is entitled Stress Levels and Availability of Resources for Graduate Students in Healthcare Professional Programs, a pilot study. It was conducted by Sarah Abdallah, Kimberly Bell, Carly Monroe, and Andrew Selby, with research mentors Sarah Maher and Jennifer Dixon. We know from previous research that heightened stress occurs in students in health professional programs. Chronic stress can impact their mental, physical, and emotional well-being. Support services may help students with stress management. The purpose of the study was to determine if stress levels varied among graduate students in healthcare professional programs and if available resources were meeting student needs. In response to the purpose, the hypotheses were stress would be similar among all participants. Within a professional program, stress between cohorts would be significantly different. Throughout the academic year, levels of stress would be significantly different, and participants would report underutilization of resources. In order to be included in the study, participants needed to be at least 18 years of age and enrolled in one of the 5 programs at Eugene Applebaum. We implemented a cross-sectional repeated measures design and used 2 surveys administered via Qualtrics. One of the surveys collected demographic data and the other collected information regarding stress. We had 2 data collections, the first being between midterm and finals during the fall semester and the second in the first month of the winter semester. The first hypothesis, that stress levels would be similar among all participants, had significant findings in the first data collection taken in October of 2019. Significance was found for 8 domains of stress, as well as total overall stress. The results of the data collection during January showed significance in 4 domains: fear of failing, academics, faculty, and total stress. Similar to the October findings, the nurse anesthetist participants were the least stressed, and the pharmacy participants were the most stressed. Therefore, our first hypothesis was not supported. For the second hypothesis, the cohorts that were compared were those of the physical therapy program. During the first data collection, the second-year participants had greater stress in the 6 stress domains shown on the slide. In general, the second-year cohort were more stressed than both the third and first-year students in all domains except for academic stress. In this domain, the second-year participants were only more stressed than the third-year participants. Although stress decreased at the beginning of the winter semester, the second-year students reported more stress than the first and third-year participants in faculty interaction and failing. Once again, the second-year participant class was significantly more stressed than the third-year class in academics. Overall, our second hypothesis was supported. Regarding our third hypothesis, for all 5 programs, there was a significant decrease in stress levels from the fall to winter semester. Data analysis revealed significant differences in both time and total overall stress scores, both significantly decreasing from the first to second data collection. Participants of the nurse anesthetist program showed a significant increase in world stress, and participants of the pharmacy program showed significant decrease in stress due to fear of failing, time, feedback, and total overall stress. Overall, our third hypothesis was supported. Utilization of available resources as well as the level of satisfaction of resources was assessed for the fourth hypothesis. The resources that were assessed can be found on the table. Most participants were aware of campus resources. Participants used and were satisfied with the financial support, peer buddy system, and faculty advising. Counseling services were not used by 95% of participants, and most participants had neutral satisfaction with these services. The sample was a sample of convenience due to participants being self-selected from Eugene Applebaum. Therefore, the results cannot be generalized to a larger student population. In conclusion, high prevalence of stress was seen in all participants, and stressors were consistent among programs. Participants of the PT program demonstrated different levels of stress depending on their cohort, and participants of all programs demonstrated significant differences of stress during different times of the school year. Most participants were aware of and used available resources, with the exception of counseling services, which were underutilized and had neutral satisfaction. Further research is needed to implement solutions to decrease stress and increase utilization of available resources. Below are a list of resources we used for our literature review. Thank you for listening.